The coronavirus 2019 COVID-19 pandemic has led to the introduction of a new piece of apparel into our daily life, the face mask. A significant rise in the dry eye problems has been reported among those who had never had dry eyes before. People who use masks on a daily basis for a relative period of time appear to be more prone to symptoms, especially the elderly. On post-operative day 1, patient reported a worsening in corneal staining as well as a significant rise in dryness. The majority of people reported feeling air getting blown up into the eyes from the mask. This increased airflow likely hastened till field evaporation, which, if prolonged for hours or days, can cause retinal irritation or inflammation. At our office, we encounter a lot of people who wear masks all the time. Other variables in terms of air conversion are most likely at work. Although irritation of the eye have been recorded in comparable settings, there is no discussion of continuous face mask wear and impact on the eyes in the literature. Devices that blast air about the face mechanically have also been discovered to have an effect on the eyesight. All of these studies imply that enhanced air conversion has an effect upon the eye. However, this mechanism is not detailed in the contents of using a face mask. Dry eye is a consequence of COVID-19 positive patient long-term wearing of the mask. Dry eye discomfort can lead to increased eye rubbing and facial contact. All of these variables contribute to an increased risk of eye infection as a result of extended mask use. Danger is especially concerning during the present epidemic, since there is a well-documented possibility of the new coronavirus transmitting through eye contact. Irritation from mask use may aggravate this or even worse. Another article authors speculate briefly that more frequent eye contact may boost viral transmission due to the unpleasant sensation of air blowing into the eyes from the face mask. This condition raises concern about eye health and increases the risk of disease transmission in long-term mask wearers. Masks with a malleable nose wire should be used with special care taken to prevent air being directed into the eyes. Patients who experience dry eye symptoms after wearing a mask for a lengthy period of time should take pauses every few hours to remove the mask, allow the mask to recuperate, and reapply lubricate eye drops. This mask exacerbated ocular irritation. If present, raises concern about eye health and increases the risk of disease transmission in long-term mask users.
Assalamualaikum, my name is Muhammad Syakrin Muslim, the student from Diploma in Psychology. Today I want to talk about does the usage of face mask limit our research process. First of all, coronavirus has been spreading around the world. Even all the nations in this world have the cases of the COVID-19. The government around the world, especially the nation that have been affected by COVID-19, was required to wear the mask. However, the surgical mask can bring the problem to human ventilation process to the human organs such as skin. Wearing a mask is very important, but sometimes it will bring the big problem to the sensation process and human organs such as skin. Wearing longer masks can bring the effect like eczema, skin problems, and skin health care, and many type of another skin problems or disease. This skin problem and disease can disturbing the sensation process of skin. As an example, when you use the old towels have the little germs will be stuck in the surface of the towel. When you use the old towel to clean up your body, the germs will transfer from the towel into your body, especially your skin surface. In addition, the germs are like to interfere with the sensation process of skin, such as skin organs. Mostly they will interfere the skin organs such as thermoreceptors, epidermis, and many skin cells that was located in our surface of the skin. The point that we got here is wearing a face mask or surgical mask is very important to our safety to prevent the pandemic. However, prolonged masks and wearing for a long time can disturb the process of sensation. That's only what I want to say and my discussion and my opinion. Thank you.
Hi, Assalamualaikum. My name is Yazrin and I am psychology student for myself. The purpose of this video that I am recording right now is to tell whether when you're wearing a mask it will limit our sensation process. So basically, based on perspectives of mask, the usage of mask it do limits our sensation process because it's cover and integral of breathing. The sense of smell serves a variety of purposes, including detecting traits as well as contributing to taste. During the process of breathing, chemicals in the air approach the nose, which are detected by the 10 million to 20 million receptor cells. The top of the nasal canal contains smell receptors. They deliver impulse to the olfactory bulb at the base of the brain through the olfactory nerve. There are many different kinds of olfactory receptors. When various combinations of receptors are triggered, people perceive unique odors. The sense of smell is strongly entwined to memory because they are in the same part of the brain. Thus, when you're wearing a mask, it will interrupt and hinder our nose from smelling the chemical air. This will affect our sensation process. Thank you.
Hi, Assalamualaikum. My name is Siti Nur Fatia binti Purbaya Elaria Zakaria. My normal metric is 321200791. So today, I want to discuss as for mask. Face mask limit out sensation process to hears. COVID-19 illnesses now with this spread and every human being must take precaution to provide contracting this terrible disease to protect themselves and their loved ones. They must wear a face mask whenever they are in public and adopt a new normal life. However, mirror injuries have occurred. People nowadays are required to wear face masks, yet face masks tend to stay behind their earlobes when the word. Their hair structures on the hairs and causes skin irritation. Wearing a face mask can be unforgettable at time, especially if it is left in the ears and off too long. When there is close fabric surgicals or other shaping for face masks, the straps are sure to irritate your ears. Even so, this is small price to pay in effort to break the COVID-19 infection chains and prevent new clusters from forming. The posterior earlobes mean to hardening or inflating at time. Still, we wear a face mask. For example, we can provide pain in the red lobes base of out ears. There are other gadgets can really pressure on your ears. Due to face covering, it is actually for human how wear hair scarves to over ear things. The trick is to sweat a boots or button to the lids and simple the face mask strap to it or simple tie it to the lips. And here's if a rope or chip tied to earlobes and wear on the back to to the head is 1 of 10. And additionally, we have an opinion of using the face mask quotation or ordering online. This where we over here change to here for face masks for too long. That's all. Thank you.
Hello, my name is Nuraini Sofia binti Ahmad Faris and my metric number is 3212000451. And now I will be discussing about our sense organ, tongue or mouth. Does the face mask hinder the sensation process of our mouth? This can be explained in a research that has been done in August 2021. The article discusses the relationship between wearing a face mask as a self-protection and in accordance with COVID-19 requirements and self-perceived sensation of dry mouth. The study detail in the article investigates the health-related difficulties caused by face mask effects as well as the foul breath as the side effect of wearing various types of face masks for varying lengths of time. The study findings suggest that COVID-19 face masks may be the blame for dry mouth. Dry mouth, or commonly known as xerostomia, is more than simply a discomfort. If left untreated, it can cause dental issues that can have a long-term impact on our well-being, our overall health, and quality of life. The sensation of dry mouth is a symptom, not a cause. Dry mouth is known to be caused by damaged salivary glands and decreased saliva production. This can be caused by a radiation therapy, trauma, infection, or syndrome, or any other causes. However, for many people who suffer from dry mouth, the cause is unknown. Regardless matter the cause, the best therapy is to encourage the salivary glands to generate more saliva. This may be accomplished by a gadget to electrically stimulate the salivary glands and causing them to generate more saliva and bring dry mouth to a halt. This article explores how wearing a mask might cause us to breathe differently, shifting from breathing through our nose to breathing through our mouth. Mouth breathing is more likely to result in self-perceived sensation of severe dry mouth. It is well understood that there is a link between the condition of dry mouth and foul breath. When the mouth is less humid and more liquid evaporate, sulfuric compounds may be produced, which will result in foul breath. As a result, the study also investigates that wearing a face mask made participants to believe that they had terrible breath. According to the study, using a face mask enhances the self-perception of dry mouth, implies that the mouth is not always dry, but rather a person has a dry mouth sensation. People wearing N95 face masks, for example, reported a more humid mouth than the people who wears medical or surgical face mask. Furthermore, the longer a person wears a face mask, the more probable that they would believe they had dry mouth and bad breath. As a conclusion, wearing a COVID-19 face mask can enhance the impression of dry mouth and halitosis, or in other words, bad breath. That is all from me. Thank you.
Hello everyone, my name is Muhammad Rosli. I am a student from Diploma in Psychology, and today I want to talk about Sensation and Perception Part B. First of all, this chapter was talking about an article and the writers, which is we will analyze what methodologies that used by the writers to create the article and experience the significant impact on public mental health or the anxiety, stress, and many so on. So first of all, we got the article from here, from the Globalization and Health Biomed Central, which was a trusted article in internet, so we can trust them. And the writers of the article is Nadia Salari, Ahmed Hussein Anfar, and Rostam Jalali, which is it could be the Pakistani or Moroccan writers. And then the synthesis of these articles is to analyze of the existing research works and finding in relation of the prevalence of stress, anxiety, and depressions, which is meant to general population during the COVID-19 pandemic. Besides that, they also are doing some methodologies like systematic, review and meta-analysis. What's this? First of all, studies found they have the focus on the problem and anxiety like stress, depression during the pandemic of COVID-19 around the people, especially the people who have very hard job and very big job they need to do. They have big tasks to settle it down. The research of these studies was searched on ScienceDirect and Best Corpus public of Web of Science and Google Scholar database, which was located in United States. This study is without the lower time limit until May 2020. In order to perform meta-analysis of the called studies, the random effect model was used and heterogeneity of studies even main studies or public studies. That's only the sentences and my discussion and opinion from me. Thank you.
When we are under lockdown and social separation orders, it is hard to maintain our previous ties. The new norms have an impact on our family connection and friendships. The lockdown not only has an influence on daily living, but it also calls into question our essential existence. Some individuals are having difficulty understanding this shift in our common social life. Plenty of our social institutions are geared to defending individual rights. If a credible remedy of vaccination is produced, social distance will become less necessary and may evaporate from public perception. If the threat remains, however, social separation will remain at the forefront of our minds, potentially becoming a cause of social friction. If social distancing is still required, it may become another manifestation of our political divisions, those who distance and those who do not. The crisis has shown us the value of seeking out to friends and loved ones, and we may choose to stay close to them in the future. When face-to-face contact returns, we should be freer and more open as a result of this. If the crisis ends, this habit becomes persistent. We may really lose social relationships. Virtual interactions are not a suitable replacement for a true human touch. We may find ourselves in an even narrower social environment than before the crisis. The fear is that after the crisis is over, we will stop talking as much. But I notice that individuals are becoming more impressive and creative in their communication.
Hi, Assalamualaikum. My name is Siti Nur Fatiha binti Purbaya Elari Zakaria. My number metric is 321-2007991. So today, I want to review, should cover journal and article. The article title is People Mental Problem in COVID-19. The research process involved in this study are listed below. Beside on the title of journal, People Mental Problem in COVID-19. This is hot topic in Malaysia, and everyone is talking about that. Emotional issues have been identified as a major issue in people's mental health at this time. Critically, the country implement the Movement Control Order or PKP. Datuk Dr. Nur Hisham Abdullah, Director General of Health, said that of the 8,318 phone call reviewed by his party, so yesterday 46.8 had experienced the problem. In addition to emotional stress, they were also worried and hungry as a result of varied social factors has income and financial problem, as we has family Academics are subject to revelating to stress, including mental and emotional stress. Anxiety and depression are two of the side effects of distress. This is prone to stress, but academic support is extremely limited. Mental health management is not highlighted as if academics are immune to mental stress and feeling. Although mental health support is generally available outside for the university, that special link and lines by government bodies, NGO or private practice. Not all academic will seek help openly outside of the universe. This is due to in fact the mental health issue counting to be stigmatized in social. Academic offer face stigma clubbing stigma against their survive. Mental health is causal. An issue has mental and emotional stress are common and expected. There must also be informed the counseling and solution can help them recover their healthy practically if assistance and support are provided early on. In conclusion, in the face of the COVID-19 pandemic, the psychology impact must be addressed. It is common knowledge that when faced with stress, feelings for anxiety, nervousness, and shyness are common. This is especially true if the situation is dangerous. It is become a problem. However, if it's an interface with the individual daily function, if this happiness get a psychiatric evaluation. That's all. Thank you.
Hi, Assalamualaikum. My name is Yasmin and I am psychology student for myself. So right now I'm in the middle of interview someone from visual department. So can you please introduce yourself?
Hi, my name is Nobatisha binti Yusmadi. I'm from Visual Art Department and I'm taking Diploma in Digital Graphic Design.
Okay, thank you for your introduction. So right now I need an opinion and suggestion on what to make a great infographic poster to present information regarding this pandemic that we are living right now.
Infographic poster is a simple poster that can understand using graphic or as known as pictures. To present information regarding the pandemic, you can use graphic or picture about the pandemic. For example, picture of people wearing masks, picture of virus, and more. You can also put information about the pandemic. For example, we have to stay at home during the pandemic. Using bright color, simple font, and interesting design can attract more audience to read our infographic poster. With this, we can convey beneficial information to community through infographic poster. That's it for me.
Thank you, Patricia. You provide me so much information. I really appreciate that. And thank you for cooperating with me.
So the first one is put some picture of your topic, any picture that can match with your topic. Second is your background and background color match with the other background. background color match with the other color. If you want your background in dark, then maybe your second or third color can be in soft color. Like if you want do the opposite way, also can. And third is give a bit info about your topic. Any info can up to you because your topic, not mine. And put some icon to make it a bit brighter or pop like cherry. And lastly, put your name and IG and your picture. It's optional, up to you. Okay? Good luck.
Assalamualaikum and hi, my name is Aina Munifah binti Ismail. I am from diploma in TESOL. I am a TESOL student.
Okay, hello Aina. Can I ask you a question?
Yeah.
In your opinion, what is the most effective way on creating an infographic poster about our pandemic?
I think the most important thing is the poster you should have a drawing, because drawing will attract people to look at the poster, and the font for the writing in the poster also need to be big and clear so that people from far can see.
Is that all?
Yeah.
All right, thank you, Aina. First, hello. Can you introduce yourself, please?
Hello, my name is Siti Putri Dewi Tishanwar. You can call me Dayu or Ayu. I am from Penang.
Hi, Ayu. Can I ask you a question?
Yes, of course.
Okay, my question is, what are some of the effective ways on making an infographic poster about the pandemic, in your opinion?
Okay, in my opinion, the creative poster design, I think, is the one that can convey a message to the audience in a unique way. Especially it's for pandemic poster, right? So the use of colors, typefaces, image, illustration. Also, the element must stand out, like the colors, the specific everybody pick up. Also, the other factors such as scalability and readability of your poster should also be considered.
All right. Is that all?
Yeah, that's awesome.
All right. Thank you. Thank you for taking your time on this interview.
You're most welcome. Thank you for having me.
Hello, my name is Nur Aidin Fatihah binti Ahmad Faris, and I am a degree student from Biomedical Science from Pusrawi International University College.
Okay, Ainil, in your opinion, what are some of the effective ways on making a poster about a pandemic?
Okay, in my opinion, first is to make sure that the visual tied to the information or data that you want to give or you want to other people to know. For example, in this case, it's about the pandemic, so the visual must be tied. You can put food or drinks picture in the poster. And the second thing is the infographic should be self-explanatory and simple enough for other people to read and understand without having to Google the extra information. And also the important thing in your infographic poster, if it's possible, put your university logo, for example, your Unicel, right? Put your university logo as it make it more trustable. Other people will tend to believe information from a big corporation or big university like that. And lastly is to make sure to cite your data, where you get your data from, the reference, like And the data must be accurate lah. The public tend to believe the data that they can see the reference from. For example, Malaysia Ministry of Health. Itu je kot.
Thank you, Ines.
Gestalt is an idea that we make sense of things by seeing things as a whole rather than separate individual parts. Gestalt in principles include law of proximity, law of similarity, figure ground, closure, continuity, and order. These principles are important in order to make a good infographic poster. As a conclusion, there are some Gestalt law principles that are explained by the respondents. For example, similarity. Similarity is the notion that we place objects with similar characteristics in a group. This characteristic can include color, font, shape, texture, and more, which was explained by respondent Aina. Also, according to respondent Idayu and Ainin, the infographic poster should have visuals and have readability, which are examples for the law of proximity. The law of proximity defines how the human eye perceives visual connections. When compared to elements that are distinct from each other, elements that are close to each other are considered to be connected. The rule of proximity allows us to make sense of written content as a whole. This is also true for paragraph spacing and other scattered text components.